session is vaguely titled, Where Do We Go From Here? And of course, we stand here now with this amazing treasure chest of inputs and ideas and suggestions. I'm going to invite a couple of thoughts from the floor about where we go from here, and I'm going to ask you again, it's very hard, many of you haven't had a chance to speak, but just to be brief, to toss some ideas about where we go from here, particularly as you reflect on today's spotlight on the role of Catholic healthcare facilities in improving access to WASH. So may I have a couple of hands, and we'll bring some mics to you for your remarks. Where do we go from here? Bud, please introduce yourselves as you speak.
Hi there, I'm Bud Rock, one of the members of the team of co-organizers for this event. Again, forgive me for not standing up, it's a bad knee. But one point that I thought I wanted to sort of highlight, and I know this is a little bit of a preparation for some of the discussions that we're going to have tomorrow, but we heard a great deal about some amazing Catholic institutions working in very interesting and challenging places. What I have found in my experiences more recently, I will say that I have been working with the Anglican Communion, and we will hear more from them tomorrow, but we have called upon those Catholic institutions to assist in some of the Anglican work as well. So once we are in the field, we are collectively faith-based. CRS has done a tremendous job. Caritas has done a tremendous job assisting us in this effort. And when I say assisting, it's not just with the faith component, it's literally WASH experts or health specialists. Let's make sure that when we talk about sharing, we are talking about literally the people in this room, because I've seen it working very effectively of late. Thank you.
Thanks, Bud. Over here? Somebody had a hand up over here? Thank you. And thank you, Bud, for modeling such a concise input.
Oh, wow, the pressure's on. Thank you. My name is Lisa, and I'm here today, I mentioned earlier, from Bloodwater. We are a collaborative fund of 1,200 individuals, probably about 20 different institutions, and we support frontline organizations working to end health disparities at the intersection of WASH and HIV. We partner with locally led organizations for 8 years at a time, and in light of the recent funding cuts, we have decided to double our portfolio. We always thought that 10 partner organizations was as far as we could go, because we go very deep and very far. And so we've decided to double our portfolio over the next 3 years. We are expanding into Malawi, Uganda, Mozambique, Lesotho, Burundi, Zambia, and Zimbabwe, in addition to our current partners in Ethiopia, Kenya, Malawi, Tanzania, Uganda. I realize you asked about Catholic efforts. We are a faith-based organization, and we are always looking to partner with Catholic organizations. So I welcome any conversations, and thank you all so much for being here with me today.
Wonderful. Thanks, Lisa. You'll have lots of interesting conversations, I'm sure, as a result of that. One or two more inputs, if we may. Louise.
Hi everyone, Louise from International Care Ministries, and I just had a quick comment, I suppose, on some of the talk about research and academia. So International Care Ministries, we work a lot with academics. And I think something that Andrea touched on earlier is just the importance of academics asking the right questions and understanding what the right questions are, or some of the misinformation that happens or misleading that happens when we ask the wrong questions. So not just asking, do you have access to water? And I think that academics and researchers, and the ones that we've worked with, have fantastic intentions. But Dr. Dean Carlin, who we work closely with, says that we have to have more than good intentions. And so I suppose my encouragement to our partners who are here from academic backgrounds is to just really be making sure that you're working very, very closely with the people who are in operations to know what is the right question to ask to get to the right answer, because when we have data that is misleading, then it helps us, it doesn't help us to actually be strategic. So just an encouragement to be a little bit more humble in how we think about how do we work with academia and our partners on the ground to make sure we're asking the right questions. Thank you.
Thank you, Louise. Anybody else like to have a word? Maggie, AKA Jamie, right?
So Maggie from WHO. I don't mean to overtake the conversation because I will speak again tomorrow, but I think there's two things of where we go from here. I've been super inspired about this discussion around compassion, around dignity, around serving from love. If we can consolidate those messages around the bigger theme of the moral imperative, especially for those outside the faith-based organizations and in particular for government, I was really happy to hear Max say, we're not letting them off the hook, right? So I think that's one takeaway. Like, can we put it into a half page and can we all use that same like song sheet for all our work? I think would be super fantastic. And the second one, which is just linked to that, is how do we capture some of these innovations that are happening on the ground, and how do we make sure that we can share those as well for those engineers and people that have boots on the ground?
Thank you so much. Anybody else want to come in briefly? Bernard and great, over here. Thank you.
Yeah, just going back to the academics, and I'm trying to understand what the right questions are, and I can give lots of other examples in other fields separate from WASH, but I think, again, no one doing research just wants to do research just to do research, at least no one I interact with at Notre Dame. So I think, I guess a question, or should there be some sort of a research agenda developed to help drive academia so people don't have to, on their own, try to figure out what the questions are. But if there was some direction from this group on, here's 2 or 3 things that we really need more evidence or information on. Like I said, I'm skeptical that we need more information on what the burden is. But I think those of you who are actually doing something, how can we show the return on investment, the cost effectiveness of these interventions, how it's improving people's health? And I think personally, by experience in other disease areas, that would go a long way to continuing to drive forward the agenda. So just looking forward to you folks for direction.
There's a challenge, Louise. Yeah, I'm sure there are many who could help to develop a research agenda. We're going to go over here, and then we're going to go to Rick. Yep.
Mi piacerebbe dire.
I would like to thank you, and thank you to this event for having given us the opportunity of giving witness of the sisters. I have been touched by the witness of the sisters, Catholic sisters, and I say that us religious men and women, we will not have peace until WASH and justice and peace do not reach all people, all people in the world. We will not be in peace until this is reached.
Rick.
Hi, I'm Ryan Kronk with
Ryan, sorry.
University of North Carolina, and I don't think I could have had a better setup for my talk tomorrow, brief talk. If you are interested in research agendas and working with partners to ask the right research questions and to learn and share stories of innovation, please join our community of practice, which brings together all of these people into one place, consolidates learnings, and is seeking to get those out. So if you scan your QR code, you can join our community of practice. And so please sign up or come find me and talk to me afterwards during the reception. I'd love to talk more.
Thank you, Ryan. Oh, Parvin. Okay, I think we're going to give Parvin the last word on this round, and then thank you.
Thanks. It's really been a great day, and I think just my final reflections are about the role of faith-based organizations, the role of the church, maybe in this case, in being consistent about certain things. I think, just listening to the stories about what drove people to work in ministry, and the fact that if we think about the times that we are in right now, there is a push for us to say, no, maybe let's change our narrative. Let's adapt to what is happening right now. So I feel like there's a challenge here also for us, as a community, as a faith-based community, to say, what do we stand by? how do we communicate dignity in a manner that really speaks to the, the foundation of why we are faith-based organizations? Yes, let's pick some of those things. I think I had return on investment. Let's talk about the, the $1 that translates to $25 if there's, if there's hygiene facilities in wash services, but the fundamentals shouldn't change. So I'm definitely taking that, because those stories that we had today are what matters.
Thank you, Parvin. David?
If I could just add one coda to what Ryan mentioned. Many of you have sent on updates for Rome that are on the WASH and healthcare facilities faith-based section at the University of North Carolina at the Community of Practice. So please take a look at with the QR code on the back, and you will see if you have sent your own report on, update on, that will be where that is. It's a wonderful resource for many organizations that are here today, some organizations that were not able to come as well. Is that correct, Ryan? Okay.
Thank you for reminding us about that, David. That's very helpful. So just to build on what Parvin and others were saying, we asked at the beginning of the day, we set out some objectives, and one of them was that we were hoping that this process today and tomorrow would frame commitments to progress and to continuing the momentum. And certainly we heard a whole range of commitments